Breast MRI can be used as a screening tool in many different situations. The American Cancer Society has recently released a list of those types of situations where breast MRI as a screening tool should be used. That includes if you are carrying the gene that increases your risk for breast cancer called BRCA. Also, if you're a young woman with dense breast and you have a strong family history of breast cancer, then that would be a good indication. Also, if you have breast cancer currently, it would be advisable to get a breast MRI to assess not necessarily the breast that is affected, but also the other breast. There's other types of genetic mutations that are pretty rare that we also recommend a breast MRI. And if you had had radiation to your chest during ages 15 to 30, we would recommend a breast MRI. And there's certain other situations such as, you know, the mammogram found something, the ultrasound can't find it, we don't feel anything, we're not sure. It's kind of a problem-solving tool in certain situations as well. It's very different from mammograms. It uses magnetism and radio waves to take pictures of the breast. Basically, it is placing you on your stomach inside a plastic. Basically, you're laying on your tummy with a kind of a plastic box that your breast kind of lay in. You're covered with a gown. You have an IV. And during the course of the exam, we do an IV injection. That IV contrast will then go to the breast and it will light up things that might be cancerous, and things that are not cancerous generally don't light up. And then we look at the images afterwards and kind of assess, is it lighting up more than other things? And we do lots of analysis on the types of contrast enhancement that's going on in the breast. And we kind of look at the mammograms and compare. It's sort of a tool that we use in addition to the mammogram. We have to compare to the mammogram and the ultrasound. The exam usually takes about 45 minutes. People who are claustrophobic are still able to do the exam because usually your head is not completely inside the tube. And in some situations, you're actually able to kind of lay with your chin and look out at the technologist, which is very nice because for people that are claustrophobic, it can be a little bit difficult of an exam. There's no compression of the breast involved, so those women who are a little bit leery about mammography, they won't have the same problem with this type of exam. Shawnee Mission is great place to come have your breast care. We are accredited through the American College of Surgeons. They have a national accreditation program for breast centers, and that's a big honor to receive. And we also have just wonderful staff here who've been at this for forever. Our mammography techs have been doing this forever, and they really treat our patients with a lot of kindness, which is just amazing. And we have these wonderful nurse navigators who lead our patients from beginning till end. If they're diagnosed with breast cancer, they lead them through the whole process. They are available for phone calls morning and night. They lead them through support groups, all different kinds of things like that. They make sure they follow up on their biopsies, etc., make sure they follow up on oncology appointments, that sort of thing. So they have someone to guide them through the process. We also have very subspecialized physicians, including our radiologist, our pathologist, our surgeons, and we all are very experienced at taking care of breast health. And so that's a wonderful thing as well. And also we're a very comprehensive center. Everything in the breast or the women's center is very close by. You can get your MRI, you can get your breast ultrasound, you can get your mammograms all within walking distance. And on campus we have oncology, we have surgery, we have pathology. Everything you need is right here on the Shawnee Mission campus. I'm Kimberly Royce. I'm a radiologist with Shawnee Mission Medical Center.